It's always worth stressing with this that for the overwhelming majority of people, this is going to be, who get it, this is going to be a mild to moderate illness. Don't forget that even if you get this illness, for the overwhelming majority of people, even in the elderly groups, it will be mild to moderate.
It is clear that the risk is very heavily weighted towards older people, but I think people translate that into, if I'm old and then I get it, I'm likely to pass away. Actually, the great majority of people will survive this, even if they're in their 80s. Then, for people who have mild disease, which is the great majority of people, to be clear, most people have a mild or moderate infection. Some of them have something which they hardly notice at all. To make an obvious point to all of you, but it's worth reiterating, the great majority of people will be managed at home. Great majority. They'll be fine. Even in the most vulnerable, oldest groups, in a very stressed health service, which Hubei was at the point when most of the data come out of, the great majority of people who caught this virus, and not everybody will, survived it. Great majority. It's easy to get a perception that if you're older and you get this virus, then you're a goner. Absolutely not. The great majority of people will recover from this virus, even if they're in their 80s. The great majority of people who have this infection will actually have a mild or moderate infection that will be managed at home and indeed will not need any testing.
I also want, at this stage, to speak directly to older people, because this disease is particularly dangerous for you, for older people, even though the vast majority of older people will experience a mild to moderate illness.
Also, because most people, the vast majority of people, get a mild illness.
For most people, it's a mild disease.
The great majority of people who get this virus, irrespective of age, will recover from it, and most of those will have a mild or moderate illness, not requiring any hospitalisation. Very important to make that point first off, because I think that is a key point for people to remember.
Now, at an individual level, the chance of anybody watching this dying of coronavirus are actually low. Over the whole epidemic, even if we have no vaccine, a high proportion of people will not get this. Of those who do get it, a significant proportion, the exact number is not yet clear, but it's certainly a significant proportion, have no symptoms at all. They get it without even realizing it. Of those who do get symptoms, the great majority, probably around 80%, depends on a number of factors we'll go on to, have a mild or moderate disease, which is sufficient that they would want to go to bed and feel unwell in some cases. Some cases they can actually just carry on doing their ordinary activity, although we ask them not to, but they don't actually need to go to the doctor or medical services, and they make a full recovery. A minority have to go to hospital, but most of these actually, the principal thing they need is oxygen, and the great majority of those will go on just to survive. And then a minority have very severe disease, may need ventilation, and of those, some sadly die with current treatment. But, important to stress, even in the most high-risk group, the majority of people who actually get this infection do not die. But even for those who get symptoms, these are the case fatality rates, and even in the oldest group, people over 80, re-stress, the majority of people who catch this will survive. But equally, the fact that actually the great majority of people will not die from this. And I'll just repeat something I said right at the beginning, because I think it's worth reinforcing. Most people, a significant proportion of people will not get this virus at all, at any point in the epidemic, which is going to go on for a long period of time. Of those who do, some of them will get the virus without even knowing it. They will have the virus with no symptoms at all, asymptomatic carriage, and we know that happens. Of those who get symptoms, the great majority, probably 80%, will have a mild or moderate disease. Might be bad enough for them to have to go to bed for a few days, not bad enough for them to have to go to the doctor. An unfortunate minority will have to go as far as hospital, but the majority of those will just need oxygen and will then leave hospital. And then a minority of those will end up having to go to severe and critical care, and some of those
sadly will die. But that's a minority. It's 1% or possibly even less than 1% overall. And even in the highest risk group, this is significantly less than 20%, i.e. the great majority of people, even the very highest groups, if they catch this virus, will not die. And I've really wanted to make that point really clearly. And if you look at the